Our people they use some kind of sickness take the play exactly this constipation and purging diarrhea. So person go tell you say, doctor, it don't dey hard for me to go toilet. So I hear somebody the last time tell us say in friend never go toilet for about 2 months. Say in friend no dey too go toilet. I say, how your friend go sit down for house? What if say something they causing problem inside? Now we know they make you fear. Say maybe you get cancer or whatever. No. But how we go take know if problem dey? By the time we can realize the thing don't go far.
Not to take.
You don't now it gets some medicine where our people they take for body pain. Some of this medicine self it make it hard for you to go kaka.
Seriously?
It dey. Those kind of medicine dey where people they use well for body pain, but no be the common one. Now very powerful medicine. It go cause you know go fit go toilet. Then they chop fruits, fibers, vegetable. If it hard you for you to go toilet.
So cassava.
They drink water if it hard you go toilet. And the funny thing be say, if you can't dey hard you to go toilet, small, you go dey scatter your bum. One day if you go collect pile, if you go collect hemorrhoid, go come out. That is why if you know say it don't hard you, you never go toilet 1 week, 2 week, or every time they come back, you go go toilet today. After 1 month, you go come back, you go toilet. I beg you, go see doctor. Make he check you.
He said, good morning, doctor. He said, what if the person stuff can't come out? Talking about that pile when you talk.
Yes.
He said, so what will be the solution?
Okay, so for pile, we go talk pile. Pile get different types or different degree. First, second, third, fourth degree. Now, depending on the degree where the person gets, 99 they go come decide the treatment. And most times now from third degree and fourth degree they do operation. So my advice to you be say make you try see a general surgeon wey go help you manage them. Sometimes it also dey family. Say people dey say for their family papa don't get pile. Chance they say pikin fit get pile because it dey hereditary and other things. But try see your doctor. Yeah.
I don't know what this person they talk for you. He said, good morning, doctor. He said she don't see doctor.
Okay.
Doctor say no problem.
Okay.
I mean the person went not the butu for like 2 months.
Okay.
She is very well with flat tummy.
And okay, so if you listen to us for radio, sometimes we go tell you somebody you go see doctor Abi.
Yeah.
Also, if you go see doctor and your mind no carry you fit still go back and see another doctor.
Yes. You
have the right. So maybe you can't see me, as I follow you do your body no carry you dey within your right to go and see another medical doctor. No be say I go come the verse say why you go no. If your mind no sweet you, so I go advise you, I beg. I no think say it okay for somebody not to kaka for 2 months and say they no, make them find out sure you get and make them check again. If they check again and they can't discover everything they okay, make una rest, I beg.
Doc, please, my own. If before my toilet they thick, like in my like stone. Now hand they take the remover. But later, it don't soft well now. But the toilet they come out. You know that, son. It don't soft well, but they come out.
Okay.
But I have that sickness before. But by God's grace, God don't help me. They don't treat me.
Okay.
The sickness in measure.
Okay.
I have it before.
But it don't. But it don't go.
We don't go. God have helped me.
Good. And
what will I do now? It's soft to we say I drink water to talk.
And now
it's soft, but they come out.
It's tough and they come out. No.
But you dey feel
and they come out, but they come out enough.
More many things there to find out.
Listen, a muzzle.
And many things there to find out because if it's soft and they come out. Maybe the test they push her out. You understand? I know.
When the last time you go see a doctor or go check yourself out now?
But since I have the secret before, but I know now. Appointment.
And when you get appointment,
when be appointment?
I will go within 2 weeks now.
Okay,
that will be the best,
But what I'm telling you, say not be say the thing, before. Don't be annoyed and we see at time. Before they thick, understand?
They hard.
They hard, strong, well. I use my hand and remember. But now, as they tell me to drink water, do this thing. Hard again. But come out as I want. Understand?
Okay, but what I want to ask you, you they feel like to go toilet at all?
How they feel?
Okay, when you dey feel like to go toilet, nothing dey come outside.
out.
If they come, but now small.
Ah,
I go use
small.
my hand
Okay,
remove. If they come,
You see the poor
but I
hand.
dey use my hand remove
Okay.
the
No,
remaining one.
no, you go still
You
need
go
to see
still need to
doctor.
see
You go still need to see
Doctor.
doctor.
This one say, good morning, doctor. This constipation thing be like the same thing with the person when we say take smoke when they smoke cigarette. Without cigar, the person can go to toilet. Emeka Igwe, 9 they talk. This one from Ojo Alaba. Who did the line talk to us?
Wow.
You want to react to that one?
No, Moko no react. Sometimes it be like that now.
Okay. Who did the line talk to us? You go ginger for the voice, so make we hear your voltage well.
Hello.
Good morning, sir.
Good morning.
Yeah. Good morning, Ratata.
And okay.
That man will say if he go toilet, he dey shit mostly. Sometimes, yeah. Some people know they eat chop. He chop small thing, and he go toilet, they expect say he go cheat plenty. You can't be those.
Okay.
Yeah,
So
okay.
now wetin what giving in garbage that if you never chop plenty, you know fit kaka plenty.
That one day.
He chop something small.
That one day.
You can't go toilet say one cheat plenty. No.
That one day.
Chop well. You have to chop well.
That one day. But what if also this person they chop well now? You
Abi
understand? That one, which you talk correct oh. You know chop plenty. How you want to go pass and come out? But what if in they chop plenty too?
Say my grandpa na pie 9 kilo. My papa get her like 5 years ago, and it was very serious. We get to use herbal and orthodox medicine to treat her. Me, I notice am now. Say me, I don't get her for 2 years. I dey treat her now, but I just want to ask, will it come back again? Pie.
I don't know what you mean by you they treat them. Depending on how you take treat them.
Is there a permanent treatment for pile?
Depends what stage your pile reach. Yes, they manage them, they treat them, and you get how you just go treat them for you. Go tell you say, blessing will come back again. Then your lifestyle and the food where they chop. But most especially if you know say you dey battle pile, which they call hemorrhoid, you need to see a general surgeon. Now
the same thing for women when they say after CS they constantly get pile for a few years.
There are many causes of pile. One of them they say when woman get belle, woman fit get pile during pregnancy, and even after she born, the thing fit dey continue. Why for some after they deliver it go because that pikin and that pregnancy and the hormones they make that thing weak around that area. That makes some women they'll get pile during pregnancy. Some women. And then elderly people too, they get them. Those with their family, they get them. Then some other medical conditions, where you go be like in a pie you get, but now those things they cause them. Your doctor need to check for you too.
You never download the Wazobia FM app? Chai! You dey miss wella. Oh yeah, download our Wazobia FM app today on top Apple Store and Google Play Store. Make you fit listen anywhere and everywhere. Join the Chukmat family today.
Wazobia FM 95.1.
Chook mouth.